I think another outcome for the consumers will be that we see today that millions of copies of popular books are sold with emphasis on a high protein, that's all the low carb, which is also high protein, or the low glycemic index books. And many people really use it as a kind of Bible. And I think Diogenes will also provide a kind of end results for whether this is actually effective or it is just hoax. So a lot of consumers will get some clarification about whether we should, and also dietitian and health professionals, they will know whether they can endorse some of these diet book principles or whether they can say for sure that this is not effective. Don't waste your time and money with that aspect. So I believe that we will get a lot of clarification, not only scientifically, but also for the consumer.
Now, what I said in the beginning, we really need to have measures for reducing the prevalence of obesity in Europe. And we also know that there are differences between different countries. For instance, in Germany and England, it is much higher, the number of people who are obese compared to the Netherlands or the Scandinavian countries. But we don't know exactly what are the different factors involved in that. Now, based on the fact that we have an integrated project where we have different aspects, where we are looking for the data and the results out of that, we think we can give some clues about what is more important and what are the important factors you can really modify to reduce the prevalence of obesity. All interested parties, and that is food industry, that is research centers, that is small and medium enterprises who are doing specific aspects of such a program, are really enthusiastic working on this whole project and getting results out of that, which can be of benefit for the European consumer. We are now halfway the project, and that means that we have now collect most of the data, and that is in the different research lines, as we call it. We have the dietary line, where we have now collected most of the data of dietary intervention based on changing the diet related to protein intake and glycemic index. That data is now coming into the main data hub computer and starting to analyze this data, seeing what is the effect of the different diets on weight in particular, but also on other health parameters. We also have collected most of the data on genetic variation in about 12,000 subjects all over Europe, where we have information about weight gain over the last 10 years. And that data will also now be analyzed in this year. So we are expecting to have quite a lot of information and results at the end of 2008.